A country like Nepal, we have our own health issues. The infectious disease are still a major problem in this part of the world.
It's a very fascinating and long story. It goes back to at least 10 to 15 years back when IVI started working in Nepal with some of the campaign for typhoid and cholera vaccination. And 5 years back in 2017-18, we were given a task of identifying clinical trial sites in Nepal. So it was a question mark because there were very few sites who were doing such kind of activities.
For thousands of years, traditional medicine was the only medicine available for the people. People still have hard time transitioning from Ayurveda to allopathy, this medicine.
Our culture is based on Ayurvedic. So if there is something contradictory to that's Ayurvedic belief, then people will delay the seeking of the care, especially in the rural area. People won't have the knowledge, probably because of the poverty also, because they cannot afford to go to the healthcare center.
There are some diseases which have been inflicting a very high mortality and morbidity in the population for a very long time, for which we sadly still do not have very good vaccines. The tuberculosis, so gastroenteritis, respiratory tract infections, and we also have every year large outbreaks of dengue. One disease on which I would like to see more being done is on the respiratory syncytial virus vaccine, because we have a lot of morbidity in the childhood population due to the RSV infection.
We are in the least developed countries, and the hygiene and sanitation becomes the number one problem. Though we are improving some extent in the hygiene and sanitation, but it is in the below standard till now.
I was suffer from typhoid when I was 13 years old, and I used to sick for the 18 long days. My symptoms were high fever, and my body used to sweat a lot at that time.
When you take IVI's mission of discovery, development, and delivery of safe, effective, and affordable vaccines, it means that we work in countries that have the diseases and lack the ability to make these diseases go away. So, for instance, we work on cholera because the cost of establishing the kind of water sanitation and hygiene that would be necessary to eliminate cholera through development is prohibitively high.
If we do a trial among our patients here and come up with a result, then so easy to apply that to our own patient. So it's extremely important that you do the clinical treatment based on your own data.
One vaccine may work in one part of the world, but it may not work on the other part. That's why it's important to see what is local data saying, which vaccine to be implemented in the immunization program. So we took this challenge along with IVI team. So we visited at least 17 to 18 medical schools in Nepal. I was amazed to see the immense potential Nepal had. But unfortunately, that was untapped potential.
That was the first GCP guided clinical trial in Nepal. And International Vaccine Institute has helped us to build a GCP guided clinical trial being conducted in Nepal. GCP stands for Good Clinical Practice.
Whenever you talked about a clinical trial, particularly in the minds of politicians as well as high officials, they were quite suspicious and they were, I would say, a bit reluctant to give a go-ahead.
It was extremely difficult to convince the politicians. Then nobody was ready to take the risk, but everybody thought it is going to be experimentation. You are trying to make Nepalese guinea pig. During this COVID pandemic, we had 8 health ministers. You imagine how difficult it would be to convince them.
There was one study proposed to Nepal, but unfortunately because of some political issues, it could not get approval in time, and because of that it was terminated. And that was very heartbreaking, to be honest, to me especially, because I worked for day and night to set up all these things. But as IVI promised, they brought a new study for the COVID-19 that we are running right now, and for that we started again.
So we developed 5 sites in Nepal. And when we started 5 years back, experience was less, but I'm very happy and proud to say that today all the 5 sites, I can claim that they are expert in doing the clinical research.
It is usually multi-centric, multi-country trials that we are conducting here. This is before it comes to market, so that it tries to mimic real practical scenario. So this phase is crucial, is the breaking point.
We separate the sample here, and then we send those samples to the specific company where it should be shipped. If it will develop here, then it will help to develop the manpower. Lab people will get to know how we can analyze the sample. If it is here only in Nepal, then we can get that result in short time.
So let me introduce our team here.
At each site, we do have a team of approximately 25 to 30 people, headed by one principal investigator, helped by many co-investigators, site coordinator, lab technicians, nurses, field workers who go to the community.
Whenever it is in this phase of study, it is somewhat challenging to convince the participant. Our participants sometimes do not talk to the family. So when they give consent, then their family members get to know that they are a participant in vaccine trial, and then they get sensitized, like, what are you doing, and you should not be. And then we lost few participants because of those reasons.
My name is Suman Shrestha. I am working at the Jhulikal Hospital at the clinical trial site in a trial vaccine. And today I am going to collect the CLA samples of the participants at the place called Namabuddha. It's a quite rainy day today, so hope my day goes well.
We have many field workers that in all the vaccine trial site in Nepal, they go door to door to the community.
Hello sir, good morning.
Hello Sumana, good morning.
सामान के ठीक छ त रेडी भयो?
एकदम सबै ठीक छ मैले सबै कुरा रेडी गरेछु आज हामी 9 बजे जाने भन्नु भएन
There are challenges to reach some remote areas, some hilly areas. So they have to overcome these challenges every day to actually inform the community leaders about any clinical trial and to make them understand what is the importance of vaccine clinical trials and how it will contribute to science.
रामसँग काउन्सिलिङ गरौँ
ठिक छ हामी पहिला उहाँलाई काउन्सिल गराउँछ राम्रोसँग यसो भनेर मलाई अलिकति रिल्याक्स फिल गराउँछौँ नि त पहिला
We have 18 rural health centers which is scattered in this area, and some are also in nearby the Everest base camp. We don't calculate the distance by the kilometers, but we calculate by the time, that how much hour, how many days it will take to reach there. You take the whole day in the vehicle and then you walk 2 days to reach to that area.
It's very difficult for them who is working on the field. They have to go by foot, they have to go by hiking, sometimes they have to cross the bridges with nothing more than a bamboo bridges in order to reach, and that too with their cold boxes in order to collect samples. Some of the vaccine clinical trials can involve women, and in some household the main decision maker can be the man of the house or the father or the husband. So they have to go to the households, to the community, make them understand that why it is important for the woman of the household to get the vaccine on time.
As a field worker, I experienced that to find the potential participant, it's too difficult. We have to go to the hilly areas or in the street where the road is not so well. We have to go by walking uphills for about 2 to 3 hours. So the main challenge is that.
They are taking one of the most important part of the science that we are doing is to invite them to the population and get them the message that this is the science has been ongoing and what is the general population's benefit if they are being a part of it.
I got to explore the new places. I got to explore with the new people. That's the most beautiful thing I've done. That's also a good opportunity for me.
A clinical trial, especially for our country, it has multifactorial benefit. Because of this clinical trial, we have developed facility, and I think it is a world-class facility to conduct any trial. I learned so much, and now I have confidence that I can run other even bigger clinical trials.
After we engage in the clinical trial, the research culture has massively increased in the last 10 years. So thanks to IVI, they come to Nepal. So that has improved our research culture, improved our research capacity.
We focused a lot on generating that experience by training. So we started with typhoid, then cholera, 2 COVID-19 studies which are still going on. Now we have started one RSV study. So by this, of course, experience is coming up. Now we cannot say that Nepal is a naive country when it comes to research, because they have already finished or about to finish 5 phase 3 clinical trials. So that's a big deal for Nepal. Many people from within the community are employed for doing the clinical research. So it's a opportunity for employment for many people within the community.
When IVI offered me a job, I was in a phase when I was about to leave Nepal. I was about to go to the abroad for my studies. But IVI gave me an opportunity to work as a consultant. It boosts my confidence and my leadership. And also it has motivated me to work furthermore in research and in Nepal, especially in Nepal.
Getting here, I can see my future. After coming here in our clinical trial, I get to know that hand-on experience about the clinical trial. When I'm working in research, it is a motivating thing for me.
We are almost at the end of this trials. We have recruited the participants, we have followed them up, and we are hopeful that we will be disseminating some positive results so that it can be used in our country.
We will do weekly follow-up to know about the health status of our participants. Now, here in our country, most of the participants do not seek health until they get more severe. So because of this clinical trial, participants develop health-seeking behavior.
What we saw during our 5-year experience is that there are many diseases which otherwise could not have been detected if they were not part of the clinical trial. And we were surprised to see when we were screening the participants, many undetected or ignored hypertension, diabetic cases came up. Tumors were found accidentally while doing the screening, and those tumors were taken care of. So these are some of the unseen benefits which are usually ignored, but we see it play a big role in improving health of the community.
So I think we need to do more clinical trials, because one benefit what we are getting from this clinical trial is the baby who get vaccination, they will be insured, they will have insurance system to 2 years. So mother are very happy because they are very poor patient.
Nepal has been a fantastic example, how you can build up a site from scratch in a way, and then bring them to the highest standard for clinical trials execution.
It has helped a lot because we have not been exposed to this kind of multi-center trial. The other thing is how the population will benefit is development of such vaccines which will also go to the WHO, and through that a country like us will also get vaccine in a moderately affordable price.
In clinical trials that IVI has been doing in Nepal and the improvement that has been shown, I think this can be a milestone for other countries that yes, even though the resources are low, the work can be done and they can still contribute to the research community, contribute to the good science as a whole.
We always need a support because we have a necessity and IVI has a capacity. So, and always capacity and necessity should work together. That makes impact in not only the Nepal, but I would say in the Asia. And along with IVI, we want to also work through the IVI with like Gavi and WHO to bring more fun in the vaccine trial.
IVI as such is a non-profit organization. We have limited resources. Of course, we are getting great support from government of Nepal. But to expand it further, of course, we will need support from philanthropic organization, as I mentioned. They need to come up with more support for a country like Nepal. The local government also need to open their doors for more and more research for the betterment of the public health in Nepal for the Nepalese people.
I think it's realistic to think about IVI's mission being over at some point when the world has developed to the point where these diseases are no longer causing problems in under-resourced settings. But I think that is decades away. COVID reminded us that it's one world, and that a problem in one part of the world can rapidly become a huge problem in other parts. And we hope that for the next large pandemic outbreak, that vaccines are a solution, and that countries that participate in organizations like IVI are really contributing to limiting the impact of diseases not only in distant places, potentially at home.